to audience, audience live stream. Okay, hello, hi, assalamualaikum to and hello, good evening to us watching. My name is Farah Roslan. I'm one of the Foundation Year 2 doctor in Pilgrim Hill. Today with us we have Dr. Intan. I'll give Dr. Intan a few minutes to introduce. Welcome, Dr. Intan. Thank you so much for joining us. As a part of our Dear Doctors specialty webinar series, we are trying to help Year 2 doctors and even medical students or doctors who are in non-training posts, specialty, and helping them out, especially in UK, where currently we are using application for training posts. So for this session in particular, we will be looking into GP training, and Dr. Intan has kindly prepared for us a very nicely laid out slides, and we will have a Q&A sessions as well at the end, in case any of our audiences wants to ask Dr. Intan, some questions regarding GP specialty training. So Dr. Intan, why don't you start off with introducing to us about yourself, and then we can start questions.
All right. Hello, Assalamualaikum everyone. My full name is Nur Intan Shara binti Yusof, but you can call me Intan. So I've done my F1 and F2 in UK, in Nottingham and Lincoln respectively, and then I applied for GP training, and then I got Lincoln to do training in Lincoln. So I'm currently GPST1 doing GP rotation in Lincoln. So shall we crack on?
All right. Okay. So, Dr. Intan, if you want to share your screen, and then I can share it to the audience.
Right. So I'll just open up my slide, isn't it? Or do I press share first? Share screen, yeah?
Yeah.
Yeah. Is that it? Can you see
it's
my?
Just loading.
Yeah, I think you can see my slides now, isn't it?
I think we are going.
Share the entire screen. Yeah. Share. Can you see that? Yep. Can you see that?
Okay. Yep. Let's move on to the slides.
Okay.
Okay. Moving on to you, Dr. Appear now.
So
if you want to enlarge the whole screen.
Okay, enlarge the whole screen. So just start the slide. Okay. Right. Ready? Right, Farah, if you can't really hear me well, then just let me know, okay? Hello?
Hello? Yep.
Hello? Yeah. If you can't hear me well, then let me know, right? Okay. So let's crack on then. So I'll divide it into sort of 4 sections. So the first one is going to be the overview of the specialty. The second one I'm going to talk about the MSRA. The third one I'm going to talk about interview, and then the fourth one is going to be Q&A. So I believe that everyone who's listening, majority is in FY2 who has actually applied to GP. So I'm not gonna talk a lot about the specialty itself, because I'm sure that everyone already know more or less about GP already. A lot of people apply GP for backup, but for myself, I applied GP for my first choice, and then medicine for second choice for my backup. Is because I've heard a few of my colleagues applied for GP and didn't actually get it. So it's not difficult, but it's not easy as well. You just have to prepare for it. Once you're prepared for it, then hopefully you can just pass and then hopefully get your first choice, because that's the most important. You get the first choice where you want to be, right? So the GP training in UK is 3-year program. So it's 4 months hospital rotation in first and second year, and then the third year you're gonna do a full GP rotations. So and then 4 months in GP, and then 8 months in the hospital. So it's the other way around actually. And then for GP, you have 2 exams. The first one is the theory exam, what we call as AKT, and the second one is OSCE exam, which is what we call CSA. And then you can only do it once you turn ST2. So your ST1 is actually like a honeymoon year. So the first 6 months, normally people will get used to the system, get used to the e-portfolio, which is massive. You have to do a lot of learning logs. That's about it really. And then the second 6 months, people normally get ready to do AKT, and then hopefully pass AKT, because AKT itself is difficult. It's challenging. So a lot of people fail as well. So that's another story. And then on to the OSCE one, which is CSA. And then there are 3 different programs, but for us Malaysians, we need to check the visa. So there are academic, just like foundation year, academic, global health, where you can take 1 year off and then do it in Africa. And then the targeted one is just for people who have done another specialty before, and then they can do the GP instead. Right, moving on to the next one. So MRCGP is actually recognized by the National Specialist Register. So I just checked this, and then we have to do 18-month gazettement before we get the credential. And then I'm not going to touch a lot on this, because it doesn't really matter if you don't finish your GP, so you don't really have to think about this. But then if once you finish GP, which is going to be in 3 years time, so you're going to need to look into it a bit more. But then is it worth it to do the GP? So I think it's worth it, well, for me at least. And then you can work in KKM, hopefully 9 to 6, no on calls. So I think for me it's still worth it. And then how about the training as a GP training? Yeah, it's in Malaysia it's called family medicine. Yes, family medicine. Yeah, and then there are, well, in Malaysia apparently there are 5 procedures that GP has to do. The family medicine specialist has to do. One of them are doing scans for obs and gynae. But in UK we are not trained at all unless we are obs and gynae trainee. So that's something that we just, I think about it later, not now. So just enjoy for now. And then GP training is chill. Hospital rotations are as usual. If you got obs and gynae, if you got A&E, you have to do on-calls and weekends as normal, on top of learning lots that you have to do, but it's all right, you can always catch up. And the GP rotation, GP is chill. You can get, you just have to see like 4-8 patients in a day, because they get 30 minutes. You get to see the patient in 30 minutes when you first started as GP ST1. So depending on your GP, it start at 8 or 9 depending, and then 5 to 6. Oh, sorry, 5 to 6. Start at 8 or 9, and then finish at 5 or 6, and then there's no weekend. So that's why it's chill. So you can have all the time that you want in life. Do medicine and do your hobbies and have family life or whatever you want. For those who haven't done GP in F1 and will not do GP in F2, I would suggest you to do Taster Week, so that you would have some ideas how's GP. Once you become a GP, it's very hectic. It's not chill. It's not really chill, because you only get 10 minutes to see a patient, and the patient is, oh my god, there's a lot of chronic patients, because nowadays acute patient is seen by normally nurse practitioners, depending on the GP practice itself. Then you have a lot of background work, like admin tasks. You have to see blood tests, you have to see this, you have to see that. You got home visit, which I quite like, because you got to go out from the GP itself. So for GPs, I think it's back to basics and the knowledge we need to know, like final year medical student, you need to know vast majority of it, but not the depth of something. And then I think GP, it's more to promoting health and keeping patient at their best state in the community, hopefully away from the hospitals. So yeah, that's it. Any questions so far? I don't think so, right? So for now, Farah said that
Just want to So I just want to mention to the viewers at the moment. So obviously the Q&A is towards the end, but if there are already questions that you have in your mind and you just want to type in the comment section, feel free. And then so once we can start asking Dr. Intan right away. Anyway, I'll let Dr. Intan rest of the presentation.
yeah, I like that because it's kind of weird to actually, give presentation without actually seeing my audience about this is what webinar is, isn't it? So I appreciate if you have any questions, please just, fire on. Yeah. I don't know about Singapore. I'm sorry because I didn't have a look. I know that for Australia, MRCGP is recognized over there. So for us Malaysian who wants to be quite close to Malaysia but don't want to work in Malaysia, so Australia is one of the country that you probably want to have on the back of your mind to migrate to. Hopefully, not. I don't know. So yeah, so for the F2s, I hope everyone has already got your invitations to the MSRA because according to this timeline that I've got from the website, you will get the invitations not later than 17 December, which is last 10 days. So hopefully everyone is actually preparing for MSRA, not actually, enjoying the Christmas as much as because it's a lot. So MSRA, you will sit on 3rd to 11th, so which is going to be next week, starting from next week, and then the result will come back on 34th. And then there have been new changes for this year. So for whoever who's got scores 550 or more, then you don't have to sit for interview, which is not too bad actually. The interview is all right. Because on during previous years, the marks was like 575, but this year they say that 550 because according to the past years, people who has got 550 or more will actually pass the interview anyway. So that's why this year they have already decided 550 is the marks, the cutoff marks that they're gonna let people pass without the interview, without having to go for interview. Last year's, like for the past few years, what they did was like making like a graph of marks, and then the top 10%, they will do like top 10% according to that. But this year it's different. So for whoever who get to do the revision, so probably if you want to aim this, you can. But if you get interview, it's all right anyway. So the first step, the MSRA. The MSRA, so for those who are not quite familiar, I hope everyone is familiar by now. The MSRA is the theory part, and then the selection center is the interview part, which is like OSCE. So the first step is MSRA. So you're going to have like profession dilemma questions and clinical problem solving questions. 95 minutes for profession dilemma, which is something like SJT questions, and then the clinical problem solving is really clinical. There's nothing like, I don't think there's any or much questions about or pathology or microbiology or the atomic level questions. Nothing like that. It's a lot of clinical problem. Just imagine if you are the GP and then you get to see those patients. Those are sort of questions that you will get. And then it's 100% computer test. It can be a bit sleepy because it's such a long exam, like 3 hours. It's like taking driving theory test. And then that's the That's the website that I got it from. Tips, as I mentioned, study now, take it seriously, have a good sleep night before, read the questions carefully, and watch your time. Because you really only have about 45 seconds to 60 seconds to answer one question. So that's why you need to watch your time, and then you need to practice the questions on the official website. About the MSRA, the website doesn't say if there's any book or any website that does mock exam. So what I did was I'm quite used to past medicine. When I was medical school, I quite like the interface, so I used past medicine, and other people said the past test is good as well, but I find that past test is the question is quite difficult. But if you want to do past test, absolutely fine, you can try both if you like. Any questions so far, Farah? No questions, yeah? And then when you're doing the MSRA, the top revision tip is you just don't answer all the questions. If you get it wrong, then learn about the explanation as well, and then learn about the answers to that question as well, because you might not know that you might get the questions about the answers. You get what I mean? Get what I mean? Yeah, hopefully you do. Yeah. Anything else I can think of? Yeah. Well, about the professional dilemmas, you will have the total marks going to be like up to 20 marks, and then you will not be negatively marked. So my tip is going to be like, just answer all questions. If you don't get enough time, if it is like, for example, 15 minutes left, just answer all questions, because you will get 8 marks anyway. So if you don't answer any question, you will lose marks. So if you get it wrong anyway, you're going to get 8 marks anyway. So please answer all questions. And then tips on answering the professional dilemmas. Just think, for now, try to focus on the work environment now, and see what sort of situation comes up, what of the problem that comes up on the daily life, and then think what would you do if it happens to yourself. And then when you answer the question, you do it like in a group, so that it makes sense. I think if you start to do the questions, then you will then it will make more sense, if you like. Anything else? I think that's it really with the MSRA. It's just studying. All right. The second step, I think everyone is more interested in the interview one, isn't it? Because there's not a lot of like websites talk about the interview ones. So if you're unlucky like me, who is not top of the cream, not top 10% of the MSRA, then you will get an interview, and the interview is not too bad, people. So don't be afraid of it. It lasts quite long, approximately about 3 hours. And the tip is wear smart casual, and then choose the closest place, so that you don't have to drive. If you have to drive, oh my god, it's some drive, and they're gonna be tired, and then you can't focus. So have to think about that as well. And especially if you have to drive or take trains, you have to think a lot about that. And then the interview is divided into 2 parts. So when you arrive, then you check in. Then you have to bring your passport or your ID, something like that. And then that's it. And then when it starts, you will go into a room, and then you cannot bring anything inside the room apart from you can't bring anything inside the room, because they will provide you with the pen, and then paper, with sweets, with food, with water as well. And then you'll be divided into 2 groups. The first group is gonna be doing the interview first, and the second one, I'm gonna do the written exercise first. I think the written assessment is more difficult as compared to the interview, because the written assessment one, let me talk about the written assessment first. The written exercise is a lot. You have to do essays, and then there are, I think, 1, 2, 3, 4, about 4 pages of questions. I mean, like, of questions. about 6 questions, something like that. And then you have to reason. So, and then you have to be quick. And then I remember that I don't really get enough time to actually finish everything, so I just rumble. So the question is just like this. It's like SEC questions, but you have to reason why you want to do that. Yeah, and then for example, this is the example of the questions. So first is to rank each issue. So you will given a scenario, and the question is going to be like to rank each issue in the order in which you intend to deal with, and then you have to justify your decision and describe what action you will take, and then you have to reflect on the challenges posed by this exercise. So GP is all about reflections, and reflections. So when you reflect, just let them know what you feel, and then say why, and then say, you know, what you feel, and then why you feel that, and then talk about patient safety. They love patient safety. So if you may, always write something about patient safety, so that they know that you are a safe doctor. And then you have to be quick. That's it. Don't take too long to think about ranking. The important thing is you have to justify why. And then when I was preparing for this, I used this book. I know that there are a lot of books outside, but I think this book is not too bad. The reason I use this book is because I got it free from someone. So I just use it. It's quite good. Right, talking about the interview. So there will be 3 stations. If you are UK grad, you will be familiar with the OSCE. So you will be like, there's gonna be a lot of people, and then where I did was in a hotel. So they're gonna have like hotel room, and then you're gonna be sitting outside, and then when the bell rings, then you're gonna go in and then do the interview. I mean, like have a chat with the whatever that you got, with the simulated patient. Then you come up, and then you swap, and then you go in again. Come out, swap, and you go in again, like that. And the funny thing is, because I studied in Leicester University, I got the same patient. I got the same simulated patient that I got for my OSCE in my 3rd year, in my 4th year, and 5th year, and I got the same patient again in my GPST1, so he can't just go away from me. So guys, yeah, if you study around the area, so you probably gonna get the same simulated patient as well. So the first, so it depends. It's not gonna be the same order. So you're gonna have a OSCE with, you know, a consultation with a patient, with a relative or carer, and a consultation with a non-medical colleague. So for the interview, as I mentioned earlier, you just have to. Oh, let me just talk about this first. So the competence that they're gonna assess is communication skills, empathy, and sensitivity. These are hot ones. So you're gonna be like, oh, I'm sorry to hear that, you know, you have to be sensitive, you have to be empathize a bit more in GP, and then you have to give them time to talk, and then you have to give some response when they say something. You need to show that you care. So those are the things that they're gonna like, and then they're gonna assess you on the conceptual thinking and problem solving. Then after they mention to you what's the problem, you have to, you know, solve the problem, and then you have to think holistically. Just don't think about the patient itself, think about the other people that's going to be involved as well. And then the professional integrity, so the capacity for you to take responsibility for whatever you say. As I mentioned here, the scenario is basically like SJT or profession dilemma questions. So, for example, while you're doing the exercise now, you can actually, you know, if you're bored or something, you can just like talk it out. Just imagine like, oh, for example, I'll give you an example like the what is it? The situation that I've got. So the one that I can remember is consultation with non-medical colleague. So the one that I've got was like HCA. And then she came to me saying that she's quite worried because she was in this Facebook group, and then the Facebook group is and the other people was talking about the patient. They were was exposing about a patient, so they were not, so they were not like, you know, apa confident. So basically it's a confidentiality issues, and then she's afraid what she needs to do, and then she asks you what should she have done. So in this case, they talk about confidentiality, social media. So you need to address the concern. You need to ask, what's the concern? What are you most worried about? If you didn't ask that, then you probably, you know, wouldn't pass that station, because you didn't actually like address their concern. Um, yeah, and then you have to explain why do you do that. For example, for me, as like when I asked her, "What's your main concern?" She said like, you know, when she joined the Facebook group, she just wanted some support, but then she didn't realize that the Facebook group, everyone in there is gonna be like that. So she's afraid that she's gonna get sacked from the job. And then I said to her, well, if that's the case, what I did was um, to assure her and then say to her that you should not participate in the Facebook group at all, and then you have to leave the group, and then just talk to one of your manager, and then I'm sure that you're gonna be all right. So that's what I did. Other people might do differently. So yeah, that's about it. And then the second one that I got was what is it, with relative, isn't it? A consultation with a relative or carer. So the one that I got was like a mother who came to you and then was worried about her daughter. And then at this point, you have to take care about the confidentiality issue as well. So you cannot, you know, tell the mother about the daughter without asking for consent. So that's one consent, isn't it? Especially if they start to talk about gilik competences, if the daughter is like 16-year-old, and then talking about contraception or something like that. So that's a hot topic issue as well. So you need to know all the hot topic issues with the communications for the interview. And then the third one is consultation with the patient. This is the weird one. So the one that I've got is like a patient who is worried if he got something, but he's scared to come to the hospital for a test, and then he has this thinking um what happened before was like his father was sick and then came to the hospital and died in hospital, and then he doesn't want that to happen to him, and he said that, oh, I know I need to get this investigation done and whatnot, but then I couldn't do it because my mom, my sister, my siblings, everyone said to me not to go to the hospital because of what happened to the father. So at this point, no matter how I address the concern, no matter how I said it's gonna be fine, no matter how I suggest whatever that I wanted to suggest to him, he still make face. He still make like weird face. He's still not satisfied. So that's gonna be something like that. I believe in the station. So my take is gonna be like, just be professional. Just, be the good doctor that you should be, and then keep on suggesting to the patient, and then always ask their concerns and ideas, and then what would the patient like you to do as a doctor? How can you help as a doctor? Does that help? And I can't remember what the people get, but basically that's about it. I would say when you start to answer the questions in SJT, really think about that kind of situation, and then how you're gonna address it when you uh, when you have to do the OSCE later on. Farah, I think that's about it.
Okay. Now, I just want to open the questions to the audience. See any comments. So, Intan, is it all right if I just
Mm-hmm. Sure.
So, so possible with moving towards more community medicine, isn't it? Disease more than we treat them. So they are also trying to source out quite a lot of doctors into GP. More than before, but obviously quite a lot of people are still inclined to certain specializations, etc. And so in inpatient, so ours where with us can only become a GP and will have some kind of like practice with the specialties that they enjoy.
Mm-hmm. Sorry, I lost you. What's the question then?
So tell us more about GP with special interest.
Oh, okay. GP with special interest. Um, yeah, of course. For GP, how do I answer the question? So yeah, if you're interested in something else, so for example, for me, I was like interested in obs and gynae. So it's something that that we can actually think about while being a trainee or after becoming a GP. So it depends on you. So yes, you can specialize. And normally, the popular ones are if you're interested in dermatology, then you can specialize in dermatology. You just have to do some courses. Some courses. And then obs and gynae, there are some courses like MRCOG or DFSRH that you can do to specialize in it. And then what else? Joint injection. You can do joint injection. I recently joined a joint injection clinic, which is superb. I think that's quite a good one as well. Anything else? Rheumatology, diabetes. Diabetes is a good one as well. Especially, I think if you're going back to Malaysia, diabetes is a big thing, isn't it? But I'm not sure how it's going to translate into Malaysia scene at all. Obs and gynae possibly better because obviously a woman female patient want to see female doctor. So I think that's probably better for the female. Anything else? Not I can think
So when
of
can you do
really.
this? When can you
When?
start? When can you start?
Yeah.
Like this training. Can you do it during ST1 to ST3, or can you? No.
Yeah. I mean like I may not be the best person, but I know like someone my senior Kak Wan Mai, if you know Kak Wan Mai. She did the specialty training in obs and gynae. So she did DFSRH. So that's what she did. She did it in the 3-year program GP training, but there's some difficulty with it. Not difficulty, I mean like challenge, because you have to take your own time to do the program. And then, for example, in GP, if you are doing the GP rotation in the 4 months, you will have like one session of private study. So you may use that private study time to actually do the course. And then you have to find someone and you have to find a course to do it. So yes, it's possible for you to do within these 3 years, but I think the majority it depends on your opportunity really. It depends on the opportunity of the training. But I think you can do within, or a lot of people do after they become a GP, then they have a lot more time to actually do it. Yeah. Yes.
All right. Okay, Dr. Intan, last question.
Mhm.
If there is anything that you would do differently in your interview,
I would say
would
I
you
wouldn't
do
do
anything
differently.
differently in your interview?
No, no, I wouldn't. I think I'm all right. I think it's just a patient.
Okay.
I think it's just a simulated patient. Yeah, that's one of the things as well. I mean, like I believe, I believe in their script somewhere. Whatever you say, you just have to make that face. You just have to make that confused face. You just have to make the not satisfied face. So just keep on talking really, or keep on asking the patient, like keep on digging. If not, um yeah, keep on digging to ask, is there anything else which I have already asked? And he said like, I'm not sure really. He just said that whatever question I asked already. So yeah, I think that's it really. The most important thing, I believe, is eyes, yeah. And then yeah, and then just keep being nice, empathetic,
Listen
keep
to
giving
my patient.
advice. Yeah, say that you are there for the patient. Yeah. um Guys, whoever who has to do the interview, you just have to be empathized. I mean, like, that's top notch. Show some emotions if you're emotionless people, so just show some emotion. Just say that, I'm sorry to hear that. I mean, that you're gonna be fine, something like that. They like that. mm, yeah, just like your normal OSCE really.
Okay. Thank you for your time. I hope that presentation and sharing session was useful. So thank you very much. Assalamualaikum.
Yeah, thank you so much. Good luck, everyone, and all the best. And if you have any question, feel free to ask, me